My name is Tammy Smith, and this is my persuasive speech. I'm going to talk to you today about the prescription drug epidemic in NASPR, which stands for the National All Schedules Prescription Electronic Reporting Act. It was signed by George W. Bush in 2005 and called for $50 million to go to all the states to enact programs that would allow doctors and other authorized users, like the police, to access patient records. To date, they've only received $2 million as a result of denials by the Appropriations Committee. I found an article on dailyfinance.com that talks about Dr. Manchikani, CEO and Chairman of the American Society of Interventional Pain Physicians, and he said that Americans constitute 4.6% of the world's population. They consume 80% of the global supply of opioids and 99% of the global supply of hydrocodone, and 2/3 of the world's illegal drugs. I was completely shocked by these numbers. 80% of opioids and 99% of the global supply of hydrocodone? These numbers are crazy. I don't even understand how this problem has been swept under the rug for so long. And I want to tell you the difference between opioids and opiates. Opiates are drugs derived from opium. Opioids refer to the synthetic opiates, which are drugs created to emulate opium. However, they're a little different chemically. Now, the term opioid is used for the entire family of opiates, including natural, synthetic, and semi-synthetic. Controlled prescription drugs are the 4th most abused substance in America, besides tobacco, alcohol, and marijuana. Between 1999 and 2002, the number of opioid poisonings on death certificates increased by 91.2%. Heroin deaths increased by 12.4%, and cocaine deaths rose by 22.8%. Now, the last two numbers are still too high, but 91.2%, that's the increase of opioid poisonings, and that's mind-boggling. With the recent celebrity deaths like Michael Jackson, Anna Nicole Smith, and Heath Ledger, hopefully something's going to be done about this growing epidemic. Dr. Manchikani pointed out that 60% of patients who abuse drugs, they receive them from one doctor. Another 15 to 20% come from doctor shopping. That's where they visit more than one doctor, but they don't disclose that fact to any of the other physicians. Then they take the different prescriptions to the different pharmacies, and every time they have them filled. As long as they don't say that they have insurance, they want to pay cash, they can get the pharmacy to fill it, and it's only on the pharmacy database. It doesn't show a record with the insurance. Now, according to a CDC report, prescription drug overdose, state health agencies respond, in 2008, drug overdose became the second leading cause of unintentional injury death in the nation in 2002, just behind motor vehicle injuries. The 35 to 44-year-old age group had the largest increase. And the CDC report also states that between 1999 and 2005, the annual number of unintentional drug overdose deaths in the United States more than doubled, from 11,155 to 22,448. According to the CDC report also, in 2007, more teenagers use opiates recreationally than use marijuana. But the Office of National Drug Control Policy reported that more teens use prescription drugs over anything but marijuana. Either way, this is completely unacceptable. Most of these kids are getting them out of their parents' and grandparents' medicine cabinets. I was shocked to see that the number one key interview finding from the CDC report was that most state health agencies recognized that prescription drug overdoses was a growing issue, but only recently realized its magnitude. Most agencies became aware of the overdose problem through the mortality data. We shouldn't have to wait until thousands more people lose their lives before something's done about this problem. We have to do something now. Dr. David Cloth, a Connecticut-based pain physician, was recently quoted on govtech.com as saying, "Such a program recently came in handy for me. After hearing a litany of excuses from one patient, from running out of his medication early to losing the bottle, saying his wife washed it, whatever, he checked the state database and found out that the patient had seen 35 doctors and was prescribed medicine from 25 pharmacies. Dr. Cloth said it was very easy to get addicted to the medication, and the drugs will take a hold of you. That's why it's so scary about these medicines. By the time you realize you have a problem, it's too late. You probably already have one." Dr. Manicani also estimates that we could probably reduce the prescription drug abuse by 30 to 50% in the next 5 to 6 years. Isn't that worth it? 41 states has already passed legislation, but only 34 are operating. And I have lost several family members and friends to this disease, from accidental overdose to suicide, just from pills destroying their liver and having hepatitis C. We need to educate ourselves and our kids about the dangers of medication. They are not something to mess around with, and we need to remember that even though a doctor prescribes them, they're still not safe to use unless a doctor is completely and totally aware of everything that you're taking. So we need to urge politicians to follow through on the nationwide database, get this running as soon as possible. One more life lost is too many. Thank you.